Hello, I'm Caleb. I am a student physical therapist,
My name is Amanda. I'm a student physical therapist.
and today we're going to be talking about paraffin application. Okay, so first things first, before you even talk to the patient, you'll want to wash your hands, and then you want to walk in and introduce yourself to the patient. And you want to tell them a bit about how the paraffin is going to benefit them, such as increase range of motion, help decrease pain, and it's going to help condition the skin so it's nice and soft. And you want to ask them if they have any contraindications or any precautions. Before you let them wash their hands, you want to assess the area of the skin. You want to look for any swelling, temperature, sensation, and appearance of what you're dipping in the paraffin. And then you want to prepare the paraffin itself by checking sure it's at the right temperature. That way you get the benefits and the patient doesn't burn themselves.
So before you have the patient stick their hand in the paraffin, you want to make sure that you're removing any jewelry, you're rolling their sleeves up, the patient's washing their hands good to keep the paraffin cleaned. You want to make sure that you're explaining what the patient feels, maybe even show that the wax is safe, maybe dipping your finger in it, making sure that they know it's not too hot. You want to assist the patient with dipping their hands in the paraffin wax about 6 or 12 times, letting the wax drip off, and then you want to avoid touching the sides of it, keeping their hand open and flat. After you're done, you want to put it in a bag, put a towel over it, or sometimes you can use these cloth hand towels, and then you want to let them sit for about 15-20 minutes with that on. You want to make sure you're giving them a timer, checking back on them to make sure they're doing okay. After you check the patient, after a few minutes of them sitting there with the paraffin on, you want to make sure you remove everything, remove the paraffin, and recheck the area for any indications of any redness, and ask the patient what their pain level is and how they're feeling.